Rydalbaw, John Williams dwi, Cadeirydd y Bwrdd y Corff Llywodraethu Iechyd Allgol Bai Abertawe. Croeso cynnes i cyfarfod bwrdd arbennig hwn heddiw. Croeso mawr i Liz Ricks a Tina Ricketts gyda ni am y tro cyntaf heddiw, ac i Pat Dunmore gyda ni yn ffilchio am y tro cyntaf. So, good morning everyone. I'm Jan Williams, Chair of the Board of Swansea Bay University Health Board. The board, of course, being the governing body of the organisation. And we're extending a very warm welcome this morning to Liz Ricks and Tina Ricketts, joining us respectively from nursing and workforce and employee as executive directors. We're delighted to have you both with us. And we can say a formal welcome to Pat, who's now official. So therefore, you can speak, Pat.
Yeah.
So this is a special board meeting, as everyone will know. We normally have a bi-monthly meeting of the board when we cover the breadth of our role and responsibilities. There are times, though, when we have to take specific items out of our normal board meeting cycle, and we're in that position today. The board will remember that at the March meeting, we took our annual plan for 25-26, wrapped up as far as we could in an integrated medium-term plan. The board decided not to approve the plan, given the level of deficit in it. We did agree to send it up to Welsh Government for scrutiny and assessment. We've had the response back from Welsh Government, and that is the purpose of the board meeting today, to consider everything that Welsh Government has told us, and then to consider and agree what we say back to Welsh Government in response. We're also committed to operating in an open and transparent way and putting as much information in the public domain as we possibly can. So we're taking the opportunity of this special board meeting to provide updates on mental health and maternity and neonatal services, both of which, as people will know, are special programmes of work. And yesterday, the Welsh Government launched its 10-year on mental health, and we'll be hearing a little bit more about that. And that will feed into our strategy refresh, what we'll be hearing about in a board briefing later this afternoon. We have board briefings so that the board can start to think about specific issues before we bring them into the public domain. So turning now at our agenda, we'll turn to the agenda now, and we've had apologies from Keith Lloyd and Nuria Soleh. Can I just ask if there are any declarations of interest in relation to today's agenda not already on our declarations of interest register? Chris, do you have it?
Yeah, I have a relative working in mental health, just to clear that.
Yeah, thank you. Right. So we'll turn then to our substantive item, which is an update. So Pat, have you got?
I just wanted to check, because I'm a trustee of the Children's Rights Unit, which receives funding from the board. So do I need to declare a?
No.
Okay.
We don't have any sort of funding issues for that body under consideration today. Absolutely fine. But thank you very much for that. So, Darren, I'm going to turn to you now to give us the opening update on where we are with Welsh Government. Following that, I'm going to ask Pat as the chair of the Performance and Finance Committee to give the committee's perspective, ask other members of the committee if there's anything they want to add, and then I'll open it up. So Darren, try to you, please.
Yeah, thank you, Chair. And firstly, just to say I'm grateful for the opportunity to update the board today in a special session to consider the transparent finances of the organisation. And just for clarity, a detailed presentation and discussion on this matter took place at the Performance and Finance Committee on Tuesday of this week. And that was extended further to other independent members of the board, not just the usual membership of the Performance and Finance Committee. As you've just stated, Chair, the board will recall that on the 27th of March, we collectively agreed to submit a plan rather than approve a plan, recognising that then that would be subject to scrutiny assessment by government. Just to be absolutely clear, the target control total for this health board is 70 million deficit, and the statutory duty of the health board is to break even, and because that plan fulfilled neither of those, that decision would like to bring some of the details shared with you today. On the 11th of April, we received the response to that submission from the NHS Wales Chief Executive, stating that the plan is unsupportable and acceptable, and that incoming letter is Appendix 1 to my report. Thank you very much. And what that letter stated was that further urgent work was required to de-risk the plan, to identify options and choices, and available to the organisation to further improve the deliverability of that plan, and then to potentially move the deficit plan further forward. And the substance of that more detail is set out on page 4 of the report before the board today. In response to that, I've prepared a paper which is 5 key areas, Chair. The current savings position where we are as of Tuesday of this week, the savings pipeline which will feed into the savings trackers, some of the mitigating actions we're looking to take, recognising that we are not where we want to be in terms of savings in the first quarter in particular. A little bit of detail on the systems and processes to deliver the savings, particularly through the Recovery and Sustainability Board, and just a narrative, an important narrative on the position in respect of the further options and choices the government have asked us to start to develop. So, and then further, we've had a supplementary letter, which is referred to on page 4 of the report regarding external support, and I welcome that from the government. The full correspondence isn't in this report, but it has been circulated to members, and members will be aware of the content of the letter. We can support it by direction of travel and the assistance we've asked for. And also that letter contains some very detailed requirements set out for us in the target convention for finance planning strategy. And we will now work through that and how we address that in good governance and transparent governance in the organisation. So turning to the main areas, page 5 of the report sets out the current savings levels as part of the formal savings report. And as we go through this, reminded that the savings target is currently in our plan is 55.4 million, which is 5% of our delegated budgets in this year. Those savings levels state that we currently have 16.971 million identified across a range of red, amber and green. In order to de-risk that, we need to move the reds to greens. And there is also a requirement on corporate directors, because that number is a service number, to save 1.2 million. And whilst that's not in the analysis, I'm confident we'll get that 1.2 million. We will retain the spends in the corporate areas based on holding where we are. We're going to further improve on that as we review the corporate contribution to the organisation. That number is an improvement of about 3 million from the savings reported about a month ago. So it's progress, but slow and not at the scale and pace that we took. Page 6 of the report outlines the detail of some of the detail of the pipeline of savings that we will be looking at to translate into track and savings. And that's derived this morning, derived from a benchmarking of length of stay, procurement, methods management, and also reflects the requirements from the Cabinet Secretary's enabling actions on variable pay management, which we've been building up to through last year, but we need to see the traction on that in terms of workforce redesign and stable workforce with less variable pay, and I'll touch on headcount. We have seen in the last 5 years an increase in full-time equivalents in the organisation of 2,000 headcount. There will be a variety of reasons for that. We need to take significant challenge to why that's happened, understand where that's happened, and then look forward, certainly immediately in this year, over a 3-year period, to see what workforce redesign needs to look like, reflecting our service and quality ambitions, but also respecting the financial envelope which we operate. And just for context, last year we spent just shy of 100 million on staffing. So success against the 55 million savings programme will have to, in some part, but a large part, be driven by our workforce redesign and variable pay management. In terms of mitigating actions, recognising that the savings programme isn't where we want it to be, I've met with all budget holders and asked them to identify what they can do further in months 1, 2 and 3 to, even if non-recurrently at this stage, just to manage spend while we build up the recurrent savings programme. And for clarity, the Health Board has maintained the controls that were in place in financial year 24-25 and rolled them into this financial year. There's been no artificial line between the end of March and the start of April. We're continuing with that regime. And from a governance assurance perspective, I've set it in the paper over pages 6 and 8, the mapping of how reporting lines work, also the structure of the Recovery and Sustainability Board. I think it's fair to say that the really helpful debate in the Performance and Finance Committee on Tuesday means we probably need to clarify some of those, make that a bit more elegant, and I've done a bit of work on that since then, and we can discuss that in a separate conversation. But I started to share that with colleagues just to see that they started to make the wiring. And from an options and choices perspective, on page 8 of the report, I referenced that the executive team collectively have been working on a number of options and choices outside of the current plan that would be incredibly challenging to implement, but that require further work for us to fully understand the financial impact of those, reputational, quality and other impacts. And at this stage, we're not in a position to share those because we need to do very proper due diligence and detailed work on those. We follow those into a discussion with Welsh Government and between themselves when that's ready. And clearly, we'll be appraising the board of those as they emerge within the next month or so, but we're not quite ready to share that yet. We are taking that very seriously because we will need to test ourselves as to what further things we can do or may need to do to get the financial position to improve. And that's a very challenging thing. And the other things referenced in the report is the good work and the progress we're seeing through our regional joint committee work with Hywel and seeing the service opportunities there, but also the developing conversations with Cardiff and Vale across South Wales for other tertiary services and how we may address those both from a sustainability and quality perspective, which could bring financial benefit as well. So that's part of the thinking. So in summary, section 2.6 on page 9 of the report brings the numbers together. There's 16.97 million savings back. There's 22.6 million in the pipeline based on benchmarking and good analysis, and we need to translate those now through the exec-led work streams into the savings track themselves. And the small number of difficult choices we've been able to quantify currently are at 7 million, but there's another 17 of those we need to work through. So it's not something I would like the board to consider in detail at this stage. It's an indicative piece of work that we need to just go through. And clearly, when you add those together, they do not at this stage give us the line of sight to the 55 savings requirement. The external support that we've asked for, I'll be commissioning over the next couple of weeks and developing a specification for that, which I will share with and consider in detail, not just with the board of PFC members, but with the NHS Executive Finance Delivery arm. There's oversight on that, so we'll be doing that very publicly, very transparently today. And just for reference, I've referenced in the paper the need for an accountable officer letter to go into the system tomorrow. I have drafted that to reflect this paper. That's with the Chief Executive at the moment. It's not for sharing yet because we need to reflect the nature of today's conversation in a final letter, just to say we are prepared to do that to meet the deadline for tomorrow, but that's why that hasn't followed the paper at this stage. And then finally, an important point, at this stage, the plan in terms of delivery, performance and quality is unchanged. As we have shared with government for assessment. What we are working really hard to do is to make the financial delivery of that plan more effective and more sustainable. So what I've talked about today is how we save and manage better, more efficiently, effectively, productively. It's not about at this stage changing the plan. So commitment to planned care, modernisation of general and urgent emergency care, and the work we'll consider later on mental health and LD continue in the vein of this. And we're looking to make the financial efficiency key to that. So I wasn't going to go to the recommendation at this stage, Chair, because I'm going to come back to those.
Yeah, we'll come back to those. Thank you, Darren. And we will finish our deliberations by hearing from Abby as the accountable officer, and everybody will see the draft AO letter before it goes in. But quite clearly, it can't be drafted before the board has had a substantive discussion because people need to see the board at work, really. Thank you, Darren. So, Pat, shall I turn to you then as the chair of Performance and Finance, please?
Yeah, we went through this in some detail on Tuesday. I think our level of confidence, we considered the plan in a lot of detail last month. I don't think our level of confidence changed. I think we have a reasonable level of confidence still. PFC did feel that the 5% target, the 55.4 million, is challenging enough. And we don't think further savings should be considered in 25-26, and it will take that 3-year plan to arrive at the control total of 17 million. The savings tracker figures that are coming through currently don't offer much comfort. I mean, there's only 17 million coming through and 73% is red. So we're not expecting. There is, however, very significant opportunities within the current budget for the health board. That's being demonstrated across the themes, and we had discussions around those. We felt that there were aspects of the programme that could be improved. We had discussions on that. In particular, we wanted to see savings targets set for the themes within the exec-led savings framework. And really speaking, you know, those would be across variable pay and headcount reduction and clinical consumables. But they would equate to the 5% because those savings are then driven through the service groups and corporate directors. We thought that would give it that clarity and set the expectation and give it that clarity. Also, the choices that are emerging, many of those aren't quantified at this stage, which is fine. but we'd like to see those as they emerge being quantified. We also looked at the alignment across the programme to enable that clear line of sight. There's work streams, how those align through to the exec-led savings, themes, etc. is important, and finance. We're looking at that currently with finance to enable clarity and drive again. We're going to meet shortly to consider what we need to do to improve our scrutiny or to enhance our scrutiny. And we'll be looking across various things for that. Our agenda, whether we look at our work programme, how often we meet, what, etc. So we'll be having a conversation of that before we go into the May area. We very much welcome the £500,000 funding awarded from Welsh Government. That will give that independent external view, which is very much welcome at this point. I think that's probably.
Thank you. And I'm going to ask committee members if they want to add anything. Jean, shall I start with you on screen?
Rudar, good morning, everyone. Sorry I can't be there. Just one thing I thought we might mention as well, Pat, was the realism of some of the choices that we saw on the list. So Pat's reference to the fact that we need to have a greater understanding of what those specific targets looked like, and that we should be able to link that back to the realism of delivery of the choices that are made on the lists. Thank you, Chair.
And thank you for that, Jean. And of course, we're not bringing the list into the public domain at the moment because they are very much drafts and work in progress. So we're not in a position, they're not worked up sufficiently to share in the public domain as yet. But your points are very well made, Jean. Did you want to come back on that point?
Yeah, just to say the choices themselves are not part of the 55.4 million delivery. They're kind of out there at the minute. So they are very, I think my focus was on what the aspects that achieve the 55.4 million. And we want clarity on those pretty rapidly now to drive that forward. The choices are, if we had to go further, these are the unpalatable things, I think.
Thank you. So I'm going to turn to the current committee members. Rena, did you want to add anything?
Yeah, I mean, just to confirm, really, I think there's a lot of uncertainties at the moment in the whole thing. And I do think there's a risk that basically that there'll be an overlap and some double counting if we're not careful in terms of the savings and the themes. The savings that the service groups are going away with and the themes that we're running with. So we've got to get that governance sorted out. And I do think it is important that we as the committee with that responsibility have got good oversight of the governance of how it's working. So that's why we have the discussion about having possibly more time given over to this element. And the other thing I would say is that obviously we're 1 month into the financial year already. And obviously the savings levels don't give us the confidence we would like, really. So in a way, we've got to accelerate the pace of this, which whatever way we do it, and we had that discussion on Tuesday about the need to be going at it at a pace. Thank you.
Thank you, Rena, those points. So I'm in there. Steve.
Yeah, so what I would add, I support what Pat and Rena have said about the fact that we have a number of target areas that don't have numbers alongside them yet. And I would like to see at least estimates, decent estimates of what those numbers might throw up in each of the 3 years, because this is obviously going to be less than future years because we're already starting. And in terms of what we write to, or what Abby writes to the Welsh Government tomorrow, at the moment we're saying we haven't got a target. And I don't think if I were sitting in their shoes, I'd be very happy with that. So I think what we need to say is we're working towards a target and we will give you that target at a certain date. And I don't know what that date is. I've written down here 30th of June, if they would give us that long to come up with something that the board can be relatively comfortable with is achievable in the current year, but also in the two subsequent years.
Thank you, Steve. Before I open it up more widely and coming back both to that point and Pat's point around 55.4 million being as much of a stretch for this organisation, remembering we took out 59 million last year, 40 million of which is recurrent. So looking at the comparative position across Wales, which I think is an important point when we go back, we are what, Darren, 12% of the allocation?
Yes.
12% of the overall allocation for NHS Wales. And the level of savings we are offering this year at 55 million, that equates to something like 20% of the overall savings being offered by the 7 health boards. And I think that is a point that we need to make as well. Accepting, Steve, that, you know, they will come back to give us a target. I have no doubt about that. But it's really important that we get across. This organisation is stretched and being stretched. Now, there will be an argument to come back to say, well, in 22, 23, 23, 24, you didn't make recurrent savings. And we're going to have to accept that. But we are where we are. And in terms of what we are doing as an organisation, we more than stands up to what others are doing across Wales. And then we also have to think about the primacy of the safety and quality agenda as well. And so I just wanted to make that point before opening up more widely. And I've got Marie and Deb who want to come in. Marie, shall I turn to you first?
Yes, thank you very much. Just to say that I think the reflections and challenge from Performance and Finance Committee colleagues has been really valuable, in particular in terms of the choices that we have put on there. And I think the realism around some of those is entirely questionable. But I think in terms of demonstrating to our government colleagues that we have tested and then where we have discarded, we've been clear where we've discarded, is probably going to be quite important, because there will be an expectation that we are, you know, challenging all opportunities. But I accept entirely that there will be some on that list that was for quality and safety reasons we couldn't enact. So that was my first observation. My second one, again, in terms of the governance of the savings programme, and I think you're absolutely right, Rena, we need to make sure that there isn't duplication in terms of how we are counting against the savings plan. Equally, in terms of performance and delivery, because our delivery vehicles in the health board this year will be around UEC, planned care and on our special programmes alongside the recovery and sustainability programme. We will need to make sure that where we are driving efficiency through planned care and unscheduled care, which we absolutely will be doing, we will need to bank some of the capacity that we release through that efficiency to enable us to consume increases in demand. So again, we will need to, and this is kind of a note to self and note to exec colleagues, we will need to make sure that the efficiency savings that we're achieving in those programmes, we're clear about what is feeding into the R&S savings plan and what is going into releasing capacity to enable us to meet demand in a different way. So we know we've got a complex dynamic here that we have to manage. And it is iterative, but we do recognise that we need to get to that place outcomes.
Thank you, Marie. Deb, please come in.
It was the duplication and the double counting issue unfortunately I missed Performance Finance into this because I was with the ministerial group review. I think there will be opportunities looking at thematics rather than in service group, because it's quite siloed in service group, so there will be different opportunities, but making sure that we are clear. R&S will be thematic as well, so there could be an element in there, so we need to be really clear on what's different through the workshops that the execs are leading on, and I'm sure there will be, but we just need to be clear that there is no double counting in that and be mindful of that. So that was the only point I was going to raise.
Annalise, what's that? Looking in.
Thank you. I think my concern is our workforce, without whom we can't deliver the services in any event. And Darren's made reference a couple of times to workforce redesign. And that, I'm afraid, might set hairs running amongst staff concerned for their jobs. And the knock-on effect is their families as well. And I would like to be assured that the way in which this is promulgated all the way down from us, right the way down to the managers lower down, that savings are important, but they have worked very hard to be able to deliver the amount of savings that we've done so far. And with the concerns that we are hearing, I don't want people to be disheartened and think it's not working, because that will not help us deliver the services.
Thank you, Annalise. And I'm going to ask both Abby and Tina to comment on that in a minute. We do need to go back a while to look at workforce numbers and headcount, because it's one of the recommendations from the Ministerial Advisory Group that the Cabinet Secretary has accepted, that from our July meeting, the board has to look at headcount at every meeting. But why I say we need to go back, we lost 29% of the business in April 2019 when all the Bridgend services transferred to Cwm Taf Morgannwg. Yet in the 5 years subsequently, we have taken on 2,300 extra whole-time equivalent staff. Now, we've obviously had the pandemic as part of that. So we need to take the long look in terms of what's happened to the workforce, where is that increase, for what purpose? And then absolutely taking your points on, Louise, about we need to take the staff with us, because this is about a serious workforce redesign piece of work. So, Tina, I don't want to put you on the spot. It is your first day with us, but I'm sure that I know you've already been thinking about how you're going to approach that. So please.
Yeah, so the first things that I'll be looking at would be around the use of the temporary workforce, because you would need to rely on the permanent substantive workforce. Temporary workforce is a need for that to cover short-term sickness absence, but that should be it. What we've also seen, I think, is when we have applied the audit tool for the inpatient ward areas, we're working with Liz, and I know that's set, the uplifts are set nationally in Wales. I think that's increased the staff templates. So it's an opportunity, I think, there to look at the staffing within the inpatient areas, skills mix, and who we count within that staffing bit. So that I think would count for a lot of the growth, I think, over the last few years. I think to your point though around recognising staff, the contribution they've made to date, that's really important, and how we engage staff in being real with what the challenge is, recognising what they've contributed already, but how we work with them, because they know their job the best, they know where there are efficiencies to be made. But it's having those honest conversations at the outset. We can't continue to work, we're not sustainable, so we need to rely less on the temporary workforce, look at our staffing templates, and all work to see where we can become more efficient. So that's my initial view. Obviously, I've got a lot more detail to work through, and I can bring back an update to a future meeting.
Thank you. And we know that Brina and Workforce and OD Committee will be very much on this case with you as 25, 26 unfolds. Abby, do you want to add on that?
Yeah, thank you. And thank you for that, Tina. It's great to have you on board, and I'm really looking forward to working with you. I guess the only thing I wanted to add, I completely take your point, Anne-Louise. It is really important that we listen to our staff survey. There's an opportunity for us to do that, but we need more voices coming through. That's a really important mechanism going forward, because we had one of the lowest kind of feedback scores in terms of number of people who contributed to that mechanism. I just wanted to come back to some of the things that I shared with you when I did a sort of a 3-month stock take of what I'd seen and heard in my first 3 months. And I think there are a couple of really important things in there that we will be getting underneath with pace. One is around the organisational design. What do we need to have in place for us to be high performing and effective? And what's the operating model? So we will look at, have we got the structures right? Without throwing everything out, we need to look at that incrementally, and do a little bit of a kind of board to ward in terms of what our structures are across the organisation and what we need to be effective. How we use some of the tools that are now at our disposal that we're perhaps not using. And it comes back to some of the MAG recommendations about productivity and efficiency. I think we could probably all point to areas where we're not operating very efficiently, and there are tools where we could be much more efficient. Then with that is the performance and accountability framework. And again, being really clear where we are pushing down accountability and delivery to the lowest level possible, because actually that's absolutely right. We need to have empowered people who are able to design and work through their service model, but we need to give them the cover for that and the support to enable them to do that. And we need to strip out some of our processes. We seem to be quite and for all good reasons, it's not people being intentionally putting meetings into meeting state, but I think there's an opportunity for us to streamline and consolidate some of the processes that we've got in the organisation as well, which will free up time for direct patient contact and service delivery. And then the final piece, Jan, the recognition that there are no, I'll come to it at the end, actually. I'll come to the end. Yeah, thank you.
Thank you. Any other comments, questions? Jackie?
Related but slightly left field. I'm just a little bit concerned about the pay award, because obviously the peer review body have recommended 3%, which is about what UK government has budgeted for. The message so far is that the deficit has to come out of existing budgets. So obviously we're talking about making savings. So I'm sat here thinking that's an additional expense that we know we can't afford. I don't know if anybody can answer my question, but will we have more support from Welsh Government to fund that, do you think? Or really will it be on our backs to find that money?
Darren will answer that on the approach to funding pay awards in Wales.
I will, and there's some certainty in this, and there's no uncertainty in this, Jackie, as you might imagine. So the extant position of Welsh Government is that the wage award in Wales will be funded. They have clearly made a provision from the larger allocation for that. My belief is that that would be at the lower level of what you described. There's also a commitment through the national government, the Welsh Government, that the cost of national insurance contributions for health will be funded as well, which is a significant cost for the public sector and a significant challenge actually for other sectors. Any variation between what the national negotiated position is and what's been put in reserve will be subject to a number of different tests. And so if that's higher in England and more money needs to go to the English system, we will have consequentials for that. Welsh Government will be able to honour the funding of the wage award. If there aren't consequentials, there will be pressure on the MEG, the main expenditure group, Welsh Government in health, and then collectively we'll have to look at addressing that. So it depends on what the national picture is and how that cascades through, and they'll either be fine because the consequentials will come, or we'll collectively, as £12 billion entity, have to look at what provisions can be made in health boards and in government to cover that. So it's a watch this space, but it's potentially concerned if there are no consequences.
Thank you, Jackie. And of course, we'll be keeping a very close eye on that. Jane, did you want to come back in?
Yes, please, Jan, if I may. Listening to the conversation, particularly around, and we're discussing the finance this morning, but I think the composite of organisational redesign, the challenge that we have in finance, taking our staff with us through a huge change programme, one of the things I would urge is that we don't forget the bigger picture, that when we're looking at the organisational design, I know we've mentioned regional working, we've got obviously opportunity perhaps with private sector relationships, so that when we look at raising money, perhaps there's other ways that we could do it. But one of the things that I would like us not to lose is that ability to look up as well as looking down, and we look across the total pathway between the patient inception or connection between primary and secondary. But we cannot dismiss the huge programme that's in front of us. And one of the things for me is, although it's retrospective, it's something that we're still held to account. And I know that Darren's having the conversations, but that 17.1 was totally unrealistic, 17.1 million, that we're all aiming as the golden figure. I think what we have to do is, whilst we're undertaking all this work, is demonstrate where we are pointing out to them that that figure was, is, and will remain totally unrealistic. This gives us the opportunity to do that.
Thank you, Jane. And of course, it is unrealistic in 25-26, really. Our 3-year plan gives us a trajectory to getting there. But of course, as you say, originally it was a construct anyway. So we will be obviously in ongoing discussions with Welsh Government around that. Thank you for making that point. And the bigger one about making sure we don't take our eye off the big picture. And the board briefing later on today, in terms of refreshing our whole strategic approach, will help us make sure we don't do that, Jean. So thank you for raising those points. Chris, please come in.
Yeah, I just wanted to emphasise
three, when we're always talking about saving and cutting and redesign, it's actually to provide better value and better services for patients. And I think we have to put patients at the beginning of this and at the front of this and re-emphasise what we're not talking about is reducing our services, we're making them more efficient. And actually for staff, workforce redesign quite often translates into more rewarding careers. It's developing careers and people working at the top of their licence. And so sometimes in our language, with our communication with staff and with patients, we need to keep re-emphasising that. And we have a very robust process of quality impact assessment attached to all of our designs and our programmes, which we are also looking at that lens.
That's Chris, that's a really important point. And as I go out and about, and I know when Abby and I've been out and about together, we always hear from staff about their quality improvement work and how they are really working very hard to innovate, to think about new ways of doing it. There's a huge amount of talent out in our organisation doing some great things. So systematising that, I think, and keeping that at the forefront of our mind, really, really important. Dan, did you want to come back on any aspects of our discussions before I ask Abby to give us our accountable officer advice?
Yeah, thank you, Chair. There was a couple of points and all very helpful and constructive, and we'll take them on board. I think the points about overlap are well made. I think there's two aspects of overlap. There's the potential for double counting finance terms, which we'll be diligent on, but also there's duplication of effort. Kind of everybody working on variable pay or everybody working on continuing healthcare. The matrix I've proposed, which we'll develop over the next week or so, will clarify that and make sure the scarce resource we've got to make the change is working as hard as we possibly can, not duplicated. So it's important to make that. I welcome the opportunity for a discussion separately in more detail, just to look at the construct of the reporting through our governance arrangements. And as part of the support we get from government, we have a significant list of target intervention requirements to meet. I think we need to bring that into the light, Janice, once we develop that, so that can form part of that. I think the point about trying to profile what we've got available to us over 3 years is well made. We are very much focused on to make this year less risky and better, but some decisions now will help us for the 3-year plan. So I think we need to pay due attention to that. And those are probably the key elements. And apart from that, I really like Chris's point about how we engage the workforce in that constructive way. Those who've been to the awards ceremony see the real endeavour and ingenuity of our workforce, and I think we need to capture that in spirit. Chris, capture the feedback.
Very much. So at that point then, Abby, I'll hand over to you to give the board your formal advice.
Thank you very much. I'm going to cover a couple of the points that have been made already, and then set out where I think we're at. I did want to acknowledge the progress we made last year. I think it is substantial. And in terms of the savings programme, we achieved more savings than any other health board last year. And if you look at the graph and the profile, in the last 6 months, we've really accelerated delivery around that. So acknowledging that formally in terms of the achievements we made. And although not all of it was recurrent, a more substantial proportion of that was a recurrent nature. And it shows that we can do this and we can get traction through the mechanisms we've got in place. Of course, we continue to streamline and improve those and tighten up on those. But it can give confidence that we can put in place the mechanisms to continue to drive that at pace. The point you've just made, Chris, is a really important one. I spent a day doing accountable officer training this week, and a reminder in terms of my responsibilities as the accountable officer. But fundamentally, making sure that we are providing best value and good decision making in relation to the funding and the public money that we have at our disposal is absolutely critical. And we have to find that balance around demonstrating that we're providing value. So for me, a plan that describes both the productivity and efficiency, making sure that we are evidencing that we're making very best use of what we've got, as well as transforming what we are doing to make it more sustainable in the medium term, is absolutely the right approach that we are taking. And we have to do those things and hold those two things together as we progress our work. In relation to that, we've touched upon the organisational design, the operating model that we're wanting to strengthen and implement as an executive team, and working hard at accelerating that. And John, I just wanted to touch upon the overlay with the MAG recommendations and the escalation and intervention framework. I think the MAG, the Ministerial Advisory Group final report didn't have any surprises in there, but it's got some real opportunities for us around some very specific things around how we improve the patient pathway, coming back to the observation about patient pathways, and making sure that our patients are getting access to the services in a really timely way when they need it, but having the conversation across primary community and our specialist services around how we best deliver that. So again, really driving through and taking on board the recommendations that are both in the MAG report and also the enabling actions that are the Minister's, the Cabinet Secretary's priority. It gives us a route map for some of the things that we know we need to drive forward already. I think it's very welcome that Welsh Government recognises that we have been asking for support as part of the targeted intervention programme. It's good to have that confidence now that we can progress that work. Obviously, it would have been great to have that on board and lined up with us for the 1st of April, but we understand why we are where we are. And really confident that Darren, working with the delivery support unit, we can accelerate that and get that capacity on board to work alongside with us. Because some of the questions you're asking us about continuing to fill the savings plan, populate the what might be difficult choices at granular detail, we need that support alongside us to help us. And yes, we're benchmarking in the Welsh context. And Jan, I think the comment you made about how much we're offering up compared to other health boards is really significant. We'll make sure that is in the accountable officer letter. But we're also benchmarking with other trusts in England, looking at what other places that have achieved a similar sort of savings target, 5%, because that will be probably a good percentage point higher than any other health board. And I know, Darren, you've previously talked about looking at other places that are achieving that level and are confident that that is doable as an organisation. And we'll continue to seek out other organisations that have got a similar sort of portfolio of services in the English system and where we can learn from that as well, so that we are able to evidence that we are making progress in terms of benchmarking and learning from others and using that information. So I think in terms of the position, I think we recognise the need that we do need to accelerate the pace at which we're populating the savings, that we need to make sure our Q1 plan has got contingency in it, other things that may be shorter term measures, because what we don't want is Q1 to have completely bounced back to a position where we're making the last 3 quarters really difficult agenda for us. So getting traction on that really quickly, I think, is really important. I think the other thing that's helpful to us, Jan, in terms of that starting place, is that certainly in our scrutiny conversation with Welsh Government, there was no significant challenge about what's in the makeup of our underlying deficit position. Clearly, external support and fresh pair of eyes in it will help us with that. But it does come into play with the choices. If you think about what we are providing, we're a population of 370,000 providing specialist and tertiary services. We are delivering on quite a number of sites. It comes back to that thing of we got the most efficient operating model, and some of the choices we are exploring relate to that. How do we continue to be efficient, or how do we become efficient when we're delivering across multiple sites? And we know that in areas that will create inefficiency, that will be driving costs. So those things will be part of our conversation as we go forward. And Marie, your point around some of these things you can't do in 1 year because you have to walk our staff through these processes and our stakeholders and partners as part of that. We need to do that as quickly as possible, but that bit about the 3-year plan being really important to us in terms of when we get to a sustainable model. So, Jan, my kind of advice to the board is thank you for the scrutiny we've had through the committee. I think that's been really helpful, and we'll take on board your challenges as we fine-tune the response back into Welsh Government. I think what we're positioning is a credible plan. It is stretching. It is going to be very challenging in the organisation to execute and deliver, but we are confident that it is a plan that we can achieve and deliver, and that we can continue to get the green right across the board in terms of the things that are currently sitting as amber and red.
Pat, thank you for the kind of assurance that it's, you know, there's reasonable assurance that we can make that progress in a timely way. So I think the final piece is, Jan, just to thank the comments from committee members and board members this morning. Darren and I work on the accountable officer letter today so that we can turn it around and share it with colleagues tomorrow for any other final comments or observations. And obviously we're keeping in touch with the civil servants and the officials in Welsh Government about how our work is progressing. Thank you, Jan.
Thank you, thank you. So we move to our recommendations then if we can. So we've considered all the correspondence we've had in from Welsh Government, and we are going to welcome their support for external financial assistance to ourselves. So, you know, we all acknowledge that the savings currently set out, the pipeline opportunities, we're not there yet in terms of 55.4, but, you know, work is underway day in, day out, which we can emphasise the Welsh Government. And I think we're looking for an acceleration of pace, really. We're not just supporting it, but actually actively looking for it from the board. But for Welsh Government purposes, we are saying that 55.4 million is as much of a stretch as this organisation can cope with for 25-26, taking into account what's happened also in 24-25 and the comparative picture across Wales. As Abby had said, really. So we're also taking account and accepting Abby's advice as the accountable officer, and the response letter is being worked on. Everybody will see it before it goes in. But the fundamental message is, you know, we cannot get to a control total of 17.1 in 25-26. It is going to take us the 3 years, and picking up Jean's point as well. We need to remember it's a construct, and we need to have good with Welsh governments on that. In terms of governance, Hazel will put in her May governance report to the board everything that we think the MAG recommendations are going to mean. Had a copy of the MAG recommendations, the Welsh Government response. Judith Paget is meeting with chief execs and colleagues on the leadership board, because there, you know, there's a shared load of work in these recommendations, and particularly for performance and finance in terms of additional indicators to come in to the board and to committee level working, which will have an impact on governance and everything we need to do for the rest of the year. So I welcome the committee's intention to look at the overall governance architecture, and really Hazel would be on hand to help you with that. But we are going to have to come back to this in the May board and the July board, I think, when all the MAG recommendations will be clear, because we're going to have to start to bring in an additional set of indicators from the July meeting, the headcount being one of them. Okay. So have I left anything out? Everybody content with the recommendations? Thank you. Thank you all very much for your contribution. So we're moving then to our two verbal items that we have today. And Steve, it might be helpful if you start with letting us know what happened at the launch yesterday of the Welsh Government Mental Health Strategy, please.
Okay, so as Jen said, there was a kick-off yesterday for the Welsh Government Mental Health and Wellbeing Strategy. Important to note that the second part of it, it's not only health, it's also general well-being. It's a 10-year strategy. It's been worked up over the last 2 years, so a lot of thought and effort has gone into it, and it supports the Wales wellbeing goals, and it aligns us with the Marmot principles. It's divided into 4 areas. The fourth one is more pertinent to us, but I'll just tell you the first 3. So vision statement 1 is to put in building blocks to support actions to ensure that there are building blocks in place to support mental health and well-being. And there's a lot of descriptors around that in the strategy document. Statement 2 is that people will have the knowledge, the opportunity and confidence to promote their own mental health and well-being. Vision statement 3 is that there'll be a connected system of services where all people receive appropriate level of support wherever they feel safe. And vision statement 4, which is applicable to health more specifically, is that there should be seamless mental health pathways, person-centered, needs-led, and guided to the right support first time without delay. So a bit more detail in that. There are apparently, and it's an amazing number, 80 consultant vacancies in mental health across Wales and hundreds of nurse vacancies. So that's the sort of workforce challenge we have. The idea is that there should be an open access recovery model. And open access means same day access without a referral. So no more going to your GP, no more turning up at Ward F, what you might do, but there will be enough units across Wales where people feel comfortable that they can go and get immediate one-to-one support on that day. So a lot of challenges about workforce. So who is going to be in those places, and those questions aren't yet worked through. And of course, estate, where will they be? They will not be in hospitals. But the consultancy which has been helping Welsh Government, which is Canadian based but work globally, have enough data to say this one at a time walk-in clinic approach leads to fewer beds. There's a 3-year delivery plan. Very briefly, that's going to first describe the standards for mental health through a quality statement, develop a consistent early intervention open access offer, develop a consistent GP cluster offer, implement a recovery-oriented model of community mental health support, improve access to psychological interventions, and then as it gets more acute, transform the acute and crisis care system, making sure that inpatient care is rare, purposeful, and takes place in a high-quality environment. Improve the physical health of people with long-term mental health problems. That was a theme yesterday, that people suffering from mental health quite often have physical health issues as well. And improve safety in secondary care mental health services. So they're linking all of this to strategic mental health workforce plan with HEIW, which HEIW have worked up, and a Welsh Government digital and data strategy for health and social care. So the walk-in clinic will be a place where you can obviously walk in, but before that you'll have accessed services and support online, and etc. So a lot of work has to be done on workforce, physical infrastructure. New legislation may be considered. It hasn't yet been decided. In terms of governance, there's a joint ministerial assurance board being established, led by the minister. And there are a load of performance measures which are set out as an annex to the statement, which are fairly detailed and which we will clearly be held to account on as we develop through these 3 years. And if all of this sounds expensive, unfortunately, they note that we are in a period of financial restraint. And so the priorities that are identified in each health board as we go through this will have to be managed with existing resources, except that depending on the timing, there may be additional funding available. So that's, I hope, in 2 or 3 minutes, a summary of what was a 2-hour webinar yesterday. Deb was there as well, but she may want to add to what I said.
To add to that, we'll email around the actual strategy and the supporting documents, but Deb, do you want to add to that?
I think my takeaway view of it was it's a very high level strategy. It's very light on implementation. So I have contacted Chiara, who's the Welsh Government lead on it, to discuss further plans for implementation. It was very blue sky thinking, and the devil is going to be in the detail on some of this. I've also queried on the presence of colleagues from Canada and what's the intention with those, because that wasn't clear either. They were just there. Where's this go? So the context of that was a bit unclear. I was a little bit concerned that there's this creep towards perhaps bringing them in, which I don't think would be a great idea. Certainly for us, I think we've got our own plans that need to be aligned really closely to the strategy. Chiara fed back that at the moment it's just that review of what could work in our system that works elsewhere. It was very data light, their presentation, so it was very we achieved this, but very little background on actual numbers and how they did that. And Mel, I know, probed particularly on what it meant for bed numbers. I think the model they had started in a different place for us, and we've probably taken some of that low-hanging fruit already, and their bed base is much higher in the Canadian system than ours is. So we just need to be cautious, I think, on the detail of that. But I've asked Chiara to come and meet with us to talk us through that, and I'll make sure Mel and Marissa are teased into that as well. It was an interesting 2 hours, to say the least. But I said it's very, very high level. I think it's now is what does this mean for us, and how does that link into what we need to deliver on?
Thank you, Deb. And of course, all this is separate from all the MAG recommendations, because MAG, the Ministry did not touch mental health or primary care, really. So we as chairs have made the point that, well, one, it's not costed. As is usual for Welsh Government, they do not cost their policy and strategy documents, but they expect us then, like loaves and fishes, to actually absorb all the actual costs associated with it. And the other thing we are saying as chairs collectively, so we've got all the MAG recommendations. We've got directives on regional working. We've got mental health strategy now and everything that will come out of that. We've got a very crowded in-house agenda in our annual plan anyway. And we are going to see a whole host of new performance indicators come in, with boards expected to grapple with these at board and committee level. And really, you know, with a very, well, confined and constrained capacity and capability, because everybody's trying to do the day job. So as chairs, we have highlighted that with Welsh Government. So at that point, I think it's helpful to hand over to you to give us an update, because in fact, the strategy and everything will play helpfully into our work and our transformation programme. So
Yeah.
to you.
Yeah, thank you very much. And thank you for the opportunity just to provide a brief update. It's really helpful at every board meeting just to bring people up to speed with the work, which is progressing at pace. And you're right, Jan, for me, the strategy doesn't say anything that we weren't anticipating, but it provides a really useful framework on which we can hook our own transformation programme. And we'd already started talking about what does a model of open access look like, because we've been looking at some models where that's already happening in some parts of the UK, and we can learn. We don't need to go to Canada. We might want to go to Canada to look at their system, but we don't need to go to Canada to look at where some of the systems are working really well. Colleagues will be aware that our subject matter expert advisor came to us in a development session to give us an update in committee on the initial assessment that she'd been making around our services. She's continuing that assessment work, so looking at the wider services. She focused initially on inpatient provision, so looking at how the CMHTs and the range of services that we've got in the community are working together and do all the parts work together as a clear pathway for patients, and identifying where we can strengthen those things across the outline service model that Mel talked us through when she presented. So that work is continuing. We've extended the contract for Mel, or we're in the process of doing so. I think it's been done, Hazel, isn't it? So that she can continue at that work, both the assessment and helping us with the establishment of the transformation programme, so that she can pass it over to us and that we can carry on with that work. And that is in place. So the design of the transformation programme is such that we're just working through the wiring diagram about how we ensure we report through to the board, but it will have a driver group chaired by Narissa, who is going to work with us in a programme director capacity to drive this forward. And sitting underneath it, there will be 5 work streams. So quality and safety, really having a particular lens on, are we delivering quality and safety? What are we learning from incidents? What are we learning from Regulation 28, prevention of future death notices and other inquests where mental health has been an issue? What are we learning from the mortality data? Picking up on the point that we often see a higher level of mortality in a population of patients with mental health dying from physical issues. What are we doing around that? And I know that Jill's talked about that previously. So we've got quality and safety, we've got workforce, because as the points that have been made, although we have recently made a number of key appointments in the service, Particularly general psychiatry remains quite difficult to recruit to. And we'd already started the work around modernising the workforce in relation to nursing and healthcare support workers and the multidisciplinary team aspect of the workforce. That will come through very strongly as part of that work. Digital information, one of the things that Mel has fed back is just the paucity of good quality information. It is a lot of effort for the team to pull out from paper records and those kind of things, helpful information that they need both to manage the service on a day-to-day basis, but to give us the performance and assurance and to help with planning. So a focus around digital and information. And then the final two, the service model. So this will be really helpful thinking through what is the service we need to have in place. And it certainly needs to span right across that model that Mel described. So people living well with mental health, not needing any support. The prevention piece even before that, which the RPB has done a lot of work on in terms of emotional health and well-being, right the way through to specialist services that, and clearly we have a role in providing those for the wider population. And then the final work stream is estates. Fire alarm. And then just a couple of other things just to share with colleagues. You recall that 6 months ago we asked the NHS exec if they would also come in and do an assessment of our adult mental health services. We understand that we will be receiving the draft. Well, we've received the draft report, and we understand that they are concluding that work at the moment. And we will bring that back as part of the board report in June on a deep dive around that. I think it is saying very similar things to the things that Mel said in terms of their assessment. So it's triangulating that. And then two final things to say. We were really pleased that Judith Padgett, the Chief Executive of NHS Wales and Director General, took a big chunk of a day, was it 2 weeks ago, Jan, to come and visit our mental health services. She visited Kevin Coyd and saw for herself the estates issues and the challenges in providing high quality care there. And she came to Tonner to look at the South Wales mother and baby unit that we provide for a wider population and the inpatient older people service. So it was useful for Judith to spend time seeing those services and for us to just talk through our plans and what we're planning to do. So we were really grateful to have that opportunity. And then a final thing I've touched upon already, we will be bringing back to a special board meeting in June Mel's completed assessment of the services from the work that she's undertaken and the setup, although we're getting on with it, of the transformation board and what that work is going to look like with some clear milestones and what we'll be bringing to you on a regular basis in terms of assurance that we're making progress and that we are able to assure you and ourselves of the quality and safety of our services. So really good work in progress. Oh, sorry, Janet, final thing. Do you want to just mention the HIW visit? I know we haven't had a report yet, but it might be just useful to bring that colleagues up to speed.
We had a 2-day unannounced HIW visit into our LD services in Cardiff in Laura. Yeah. And we had the feedback, high level feedback yesterday of that. Lots of environmental and estate issues, but I have to say the feedback by the team on the team that are delivering care and their interaction with patients was outstanding. And they said they saw compassionate care, individualised, knowledgeable staff with skill, and lots of good feedback from the patients that they were able to speak to, the residents they were able to speak to, and also from families. So that was really pleasing to hear.
Okay, thank you, that's great. And at the June meeting, of course, we're also looking at the interim solutions while we're looking at what we need to do then for the substantial sustainable solutions for mental health. So there's awful lot of work going on, and hopefully that was a really helpful update. Another area where we have an awful lot of work going on ourselves and through the independent review, maternity and neonatal services.
Yeah, thank you, and I'll be very brief. So colleagues will be aware that the independent review continues its work at pace. And we are confident that at our July board meeting, we will be able to consider their final report. Clearly, we're not waiting for that. They continue to provide feedback on themes and issues, which is really helpful to our clinical teams. And as an executive team, we've asked if the oversight panel will come to share with us the themes and in advance of the report, the final report being drafted, so that we can make sure that we are understanding their conclusions that they're reaching, and have a good feel for the things that we need to take forward as part of our continued improvement. So we've got a date for that at the end of May. And of course, they're now beginning just to bring their themes together. So they are well on their way in terms of the clinical reviews for the individual cases that have been referred. They're concluding their work on the leadership and governance. And there will be, I think, some really helpful recommendations about engagement. In the meantime, we've obviously had the quality statement published in February, and the recommendation that we progress the implementation of the engagement framework. It says all the things that Ken said when he came to talk to us about how do we make sure we are really listening to the experience of women, the feedback, whilst they're in the middle of accessing our services, but also reflections after they've received their service. How do we make sure we are giving particular attention to particular groups, so Black, Asian, minority, ethnic women, disabled women, people from LGBTQT communities, in particular in terms of their experience, and how we might need to ensure that we are particularly responding to particular needs of groups as part of our service. And we're progressing with that work, and our Director of Midwifery has been feeding into some of that work. I'm really pleased that Liz is going to chair an oversight board for our own improvement journey, to really consolidate what we've been doing already, and to ensure that the recommendations that come through, we are able to ensure delivery of in a really timely way. Two final things. As part of LICE annual work programme for our area, they have completed an engagement piece of work. That's taken quite some time for them to analyse and draw together. And we're anticipating that they will publish their report on that in May. And clearly we understand that some of the people who've come forward and shared their experience, it has not been good experience, it's not been the quality of care that we would want to provide to our population. And we need to hear that and listen, and ensure that those themes are picked up. The intention was always that this would be fed in as part of the engagement strand for the overarching independent review. That is the case, and LICE and the independent review oversight panel chair are in communication about how that happens. And of course, we'll be putting in mechanisms to make sure that we're briefing staff and women to provide assurance when that report is published. And then the only final thing to say, again, we were pleased to welcome the Cabinet Secretary, who took time out of a very busy schedule a few weeks ago to come and visit the service for himself, and to talk to women and families and staff directly around their experience, so those who happened to be present in our services on that day. And that was really helpful too, so we were really grateful. Dan and I did a great job holding the jackets well there. The sleeves were being rolled up to be bare below the elbow. We'd been to visit the week before and felt we didn't need to do that, and actually it was important that Cabinet Secretary was able to go and listen uninterrupted by us, which happened. So
but sadly we couldn't find any cap.
We were looking for 50 million.
I did ask him, I said, which pocket is the check with 50 million in? That's hardly wasn't it? Anyway, but he had a great visit, and he thanked the staff, greatly for the welcome they gave him, and he really had a good insight into this.
That's great. And just a reminder that in the last report, the board and the goals and oversight, we talked about bringing at key points in our timeline during the year, more detailed report on maternity and neonatal services, and we will bring one in May. So Liz is just providing oversight to that, working with the service group. So you will have that, which will give you an update on the improvement work, what we're hearing in terms of feedback, and what we're planning to do in the next phase of the work, which is really helpful. Thank you, Jan.
Thank you. And Denise and Ken will come again to the board in May just to update us on their progress and how they see things panning out to the publication. And then, of course, you would expect us to be at work now on the transition plan, as we know the timetable for publication. We have to have a seamless transition from goals into different arrangements as we move into implementation. That's where the oversight board will come in for a deep dive at the end of May. So thank you. Thanks, Abby, and there's many thanks for picking this up because it is a really important piece of work for the board. So dwi'n cloi y cyfarfod nawr. Diolch yn fawr i chi gyd eto am eich cyfraniadau. So I'll close the meeting now and thank everyone again for the contribution. We are now going to move into board development format at 10:30, but we will need everyone to vacate the room so we can take the tables into workshop format. Workshop mode.